In a 6-2 decision this week, the Colorado Board of Health voted to not include post-traumatic stress disorder to the list of medical conditions to be treated with medical marijuana. The board cited lack of scientific evidence as the reason they couldn't support it at this time, despite recommendations from Colorado's chief medical officer, Dr. Larry Wolk. David, what did you think of the decision? I guess I was surprised it just came down to this board. Do you think there's a way to appeal this? Is this the final word for a while? What do you think?
No. The legislature in Maine in 2011 amended its medical marijuana law by saying specifically that it is allowed for PTSD, and I think that's what the legislature in Colorado should do as well. The board, in my view, was wrong because the medical marijuana was created in our state by a constitutional amendment of the people, and accordingly deserves to be interpreted broadly for its remedial purposes. It is true to say that there is not a lot of research on PTSD and medical marijuana because medical marijuana is on federal Schedule 1 in the Controlled Substances Act, which means it has, by definition, no possible medical marijuana, possible medical value. That is flat earth pharmacology. It's obviously wrong and completely unscientific. In fact, there is research that has nevertheless been done. First of all, there are rat and mice studies that have gotten very deeply into the brain chemistry of how medical marijuana helps with PTSD on rats and mice, done by Israeli scientists in journals such as Neuropsychopharmacology. And more to the point, close at hand, in New Mexico, where they legalized medical marijuana for PTSD, a doctor there did a study which was published in volume 46 in the Journal of Psychoactive Drugs of 80 patients there who used medical marijuana once it was allowed in New Mexico for PTSD, and he found that there was an average 75% reduction in their PTSD problems with no adverse side effects. That's not the final study that could ever be done, but it's certainly enough where the board should have said that's enough for us to go forward in carrying out the will of the people with their constitutional amendment.
For anyone that would ever doubt the kind of expertise we have in this panel, I challenge any other Colorado show out there to offer the word neuropsychopharmacology in their program like we have right here. Very impressive analysis there, David. Penn, do you think any legislators will take this up as something to consider next session? I mean, we have a lot of veterans in the state. We have the whole issue of the VA hospital. I think there's a lot of sympathy towards veterans getting some service, especially with something like this. I mean, medical marijuana, if we can have it for nearly anybody who can qualify for a lot of other illnesses, it seems appropriate here. What do you think?
Before I answer your question, I have to say lightning is striking somewhere, because I agree with everything David Kopel just said, even the neuropsychological pharmacology. And Dominic, in answer to your question, yes. Clearly the legislature will step up and address this issue. I appreciate the position the board's in, but I really think they exalted form over substance here. And although the medical evidence isn't overwhelming, there is enough of it here that 2 of the board members voted to approve it. And frankly, the Colorado medical director recommended approval, and the rest of the board should have done it also. When you look at the totality of circumstances, a constitutional amendment, the population that's really affected by this, mostly veterans, or the debacle at the VA hospital where they aren't getting services at the new hospital and maybe never will. I don't want to be too pessimistic, but it sort of drags on forever. And the fact that we've already got medical and recreational marijuana, and why force people with a medical condition, a proven medical condition, to have to resort to what's probably the more expensive option rather than the option that's designed to deal with medical conditions? So with all due respect and deference to the board, they made a bad decision for all of the wrong reasons. And my hope earnestly is that this will either be HB 1001 or Senate Bill 1, and the legislature will fix this next session.
Ben, as a public affairs consultant, is this something that if a state lawmaker was talking to you about what they should be tackling next year, would you advise them to get on board with this?
Well, I also want to disclose that I'm a board member of a group called the Organic Cannabis Association, so I do have some involvement in the industry, mostly from a policy level and looking at how the plant is cultivated, which I think actually speaks directly to the medical efficacy of the plant. To answer your question directly, I think that it absolutely should be addressed. I think if you look at many of the symptoms within PTSD, they are things that are already allowed to be prescribed cannabis for. So it seems like there's some specious reasoning going on. And I do think that the legislature, this is a, slam dunk, softball, whatever you want to call it. This is an easy one to fix. It's easy to want to help veterans have more options to take care of themselves. And, frankly, regardless of the lack of medical research into the space, the voters have clearly stated that we want to have cannabis on the table as a medical option. We're a heavy veteran and military state, and it's really quite galling to see this kind of ruling come out. And as everybody else is saying, I suspect strongly that the legislature will correct it.
Patty, wrap it up for us.
Well, I will confess some conflict of interest here. I think it's possible Westward accepts money from marijuana
I've
businesses.
heard that rumor. Yeah.
Although we treat it just like alcohol, we'll accept alcohol money too. Look, this is ridiculous. There has been enough research on this to show that PTSD is indeed helped by medical marijuana. The state just authorized $2 million to go to Dr. Sue Sisley of Arizona, who is doing the leading studies on PTSD with veterans. If someone can go in and say their ankle hurts and get medical marijuana, I don't see why they're going to fake PTSD. This is really an outrage, and I hope the legislature takes care of it.